let me introduce I don't want to read her name here. She had
Betty, give it to me. It's one of these young
she
people.
was diagnosed with arthritis. And she has been treated, being treated like 17 times by me by Acupuncture. She can give you some testimonial on treatment and impression, perception, whatever. Thank you for coming in.
Good afternoon. My name is Betty Petrens, and I work with Arthritis and Arthritis, so I'm always running, especially at campaign time. And during campaign, I was so sore and so stiff that I could hardly move. I met the eye 2011, and I had a shoulder pain, and he did some magnets, and so it was okay for a couple of days. And then he went away, of course. And so when I found out he was back, I had two surgeons, orthopedic surgeons, standing by to give me hip surgery. One was at Crittenden Hospital, the other one is at Henry Ford's. And I could not get out of bed by myself. My husband had to pull a rope. I have an easy chair because some mornings I would wake up and my leg didn't work at all. And I would just fall into the chair. And then they gave me a cane. I just turned 64. I don't work yet, hopefully, but I didn't want to walk around with a cane. So I found, I finally made up my mind that I was going to have a surgery. And then Olivia called, says, you remember the eye is coming back. So I held off. I was supposed to have surgery March 1st. And so I held off, and I went to see him in, I went to see him in 2 weeks prior to that, in February. And he gave me a treatment. And the first treatment, I said, oh, okay. The second treatment, I didn't have a whole lot of pain. The third treatment, I woke up, and he goes, oh, I can get out of bed, I can move. If you recall that movie where the lady kidnapped the writer and baked his legs. That's how my legs felt every morning, except for it felt like somebody was sawing it and putting salt in it, along with the bangs. So everybody was saying, get the hip replacement. So the third day, I went to it and I said, oh, I feel good. So the fourth day, I was feeling a little better, and then I said, I'll take you back, in order to get my hip replacement, I had to get an MRI. And they didn't want to give me an MRI because I have a second pellet, right by my eye. That happened when I was in the 20s, walking down the street over on the east side by my mom's house. So that's been in there for all these years. So they said it's too close to your eye. It's going to suck your eyeball out. So I decided to go in, have surgery at Crittenden. They went in, threw him out. And when I woke up, I was this big. And the doctor told my husband, we couldn't get it. It's been in there too long. My husband was mad. I looked like a monster. And I had to go to work looking like this. And so he told me, you're not going to have any fillings in your face. You might never have any fillings up under your eye. So I think it was the third or fourth time I was at the eye. I woke up that morning, my mouth had all this sticky stuff, and my tooth was bleeding, and I rinsed it out, and then it was like this, a big old lump all day, and it kept draining. And I said, maybe I should make a dentist appointment. And the eye said, well, my treatment is helping you. And I was reading something that I had brought to him, and I said, oh, I can read without my bifocals. And I wear my bifocals since I was 42. soon as you get in your 40s, young people, they want you to have bifocals. So I stopped wearing my bifocals, and I've been practicing every day to not wear them. I find after about 5 or 6 hours, if I'm doing a lot of paperwork, I might stick them on for a few minutes, then I feel guilty and take them right off. And besides my hip, I mean, I can do this. I went to the gynecologist every January. I have my pap smear and stuff, and I couldn't get my legs in a stir. I could not move my leg out like this. I could not do my leg like that. And everyone says, "Oh, you're giving this man too much credit." That's in your mind, your imagination, and I know the pain that I was having. So it was not my imagination. It was actually this treatment. My hand would shake. I work for the congressman, and I have to go to do a presentation. My hands would shake like this. I have to do like this to hold it. My grandfather's hand shook. My mother's hand shook. They tested us for Parkinson's and something else. I don't know. But since I've been seeing beyond, the only time my hand shakes is when I get really, really upset. It shakes a little bit, but not like this, embarrassing. So between my eyesight, my hand shaking, my hip, I think it's fantastic. And I go around recommending it to everybody. And so my brother has lung cancer. I'm trying to get him to see beyond now. And he says, "Oh, that sounds like magic." He's getting radiation chemo. So his wife told me the other night that starting next week, she's going to bring him to see beyond. So we're going to see what happens. But I think it was fantastic. My eyes, my hand shaking, my hip. The skin. He says, "Oh, you're pretty ashy." I says, "Yeah. I've been, I'm dark skinned. And if you don't put Vaseline or Viviol, you're ashy." And he told me to stop. And I didn't want to, because as soon as you get out of the shower, I squirt all the Viviol all over me and put the Vaseline. He says, "You're putting chemicals into your body." And that's the same thing another doctor had told me about the chemicals. And so I stopped doing the chemicals. Every now and then I see a little ash. But the amazing thing is right up here. Ladies, when you get older, you get these wrinkles here beyond your breasts. And when you're old and you wear a push-up bra, it don't look pretty. So I looked in the mirror and it was smooth. I said, "Wait a minute." I'm looking, I said, "No, that can't be." And it's actually a smoothing out here. And so I think all the doctors should practice. It's a little painful, little bit, but I also had moles on my face years ago, and they would stick me to zap off the moles. And so I would tell them, "No, don't stick me, just zap off the moles." And so that's what it feels like. A little sting, and then it's gone. And everyone has that, I'm just overjoyed that I feel good. So, and I give it all credit to the us. And there's some more things that went on, but I wrote them down. Can I look? I don't have my bifocals on, so and it's dark in here. What else did I wrote some things that he did. The nauseous. Oh, I can see that. Right here. When I first got there, he says, "Oh, do you have problems with your stomach?" That was the first or second day. I goes, "I don't have problems with my stomach. What is he talking about?" But I noticed I've been holding my stomach every morning when I get up, and I feel nauseous. And then I had irregular bowels. They told me I had irregular bowel syndrome. And they told me at the University of Michigan. And they did a laparoscopic because I was having bowel problems a couple years back. So when he told me I was having problems, he says, "That's your bladder or your stomach." And I said, That was when I first went it to him. I goes, how can you tell all these things? And then after a while, my stomach started feeling better. And not only did I go to the bathroom in the morning, I would go to the bathroom after lunch and sometimes at night. And I goes, I didn't know that was possible. You hear Dr. Oz always saying you should have 2 to 3 bowel movements a day. But that wasn't happening for me until I started seeing help. And now, but I gained 3 pounds. And I told him if I don't lose those 3 pounds, it's for him, getting him. But, and I wrote down some more. Oh, I went to the chiropractor for 7 years. Dr. Packett, he's a fantastic chiropractor. Sometimes I get this knot right up here. They wanted to give me surgery for rotator's cuff. So I went to Dr. Bob for 7 years and I refused to get that. And he says, I'll treat you for that. I goes, okay. I'm still learning all these things. I says, okay. And he treated me and it went down. I have not had any lumps here, any pains. And I think it's fantastic. And I could see it's almost like magic.